For Good Morning America yesterday, you saw reporter Sam Champion have skin cancer removed from his shoulder live on television. The cancer that Sam has is called basal cell carcinoma, and doctors say it is very treatable if it's caught early. Now, to treat Sam's cancer, doctors used a breakthrough new surgery called Mohs. That surgery is available at Gundersen Lutheran. And joining us this morning to talk more about the Mohs surgery is Gundersen Lutheran dermatologist Dr. Kurt Mueller. Good morning, Dr. Mueller.
Good morning.
Before we get to the surgery, I do want to ask you, Sam had said this cancer is not life-threatening, but what do you think, or what do patients notice that brings them into your office? What do they see on their skin?
It's oftentimes not really that dramatic. It may look like a small sore that won't heal, or sometimes it will heal, but it keeps coming back in the same spot. I've even seen younger people have what looks like an acne pimple, but it just never goes away. So really anything on the skin that stays there for more than about 3 to 4 weeks should be checked out, now, regardless of its color.
Okay. This Mohs surgery is relatively new. Why is this surgery gaining so much excitement, and what happens when you have this type of surgery?
It's actually not that new. It's probably been around for 20 or 30 years, but the techniques are evolving, so it's becoming much more refined. The real reason it's becoming popular is because it gives the highest possible cure rate while preserving the most normal skin surrounding the lesion. So obviously the smaller the defect you can create, the much nicer scar that you can result with.
Now, I watched Sam's surgery yesterday, and they did give him kind of a topical treatment so he didn't feel any pain, but it did seem like it was relatively simple and fast, and he was ready to go back to work, 20 minutes after he had it. Is that typical?
In a location like the shoulder, yes, it is very painless. Now, the complexity comes in depending more upon the anatomic body site. If this had been on his eyelid or his nose or his ear, he may have had a little bit more downtime. But other than that, I think everything should be just about as you saw on the programming yesterday.
Well, that's great. As you said, Mohs is a refined technique. So what is the prognosis for patients that have this type of surgery?
It's excellent. He should live, Mr. Champion should live a perfectly normal, active life. With the treatment he had yesterday, there's less than a 1% chance that cancer will come back. But the important thing for somebody like him is to know that there's about a 50% chance that he might get another one, completely separate someplace else. So ongoing care and monitoring will be very important for him.
All right. Well, Dr. Mueller, thanks you so much for shedding a little more light on the procedure. We appreciate your time, and hopefully, patients are getting in, being seen when they hear about things like this, and that you can treat even more people and that they can have a great prognosis like Sam Champion. Thanks so much.
Thank you very much.